Hello, I'm Dr. Setari in beautiful San Diego, California. God, I love this town. It's so gorgeous. And of course, the weather's perfect all year round. I'm here at the conference for the California Academy of Cosmetic Surgery. This is our annual meeting, and it is going to be a great one. Doctors from all over the country, actually all over the world, are coming to discuss their latest techniques, the latest technologies, some of the concepts that they've developed over the last several years. And we're all here to share with each other the best and finest cosmetic techniques for face, for body. I'm actually going to be speaking and sharing some of my concepts. I'll be discussing some of my UltraSculpt concepts on advanced techniques on how to make liposuction better. Some of the things that I've shared with you, I'll be sharing with these doctors. They're going to learn the secrets that I've already shared with you on how liposuction is a dinosaur. It's an old technique that needs to be modified. You already know that. Some of them don't know that. We're going to share it with them. And I'll be learning some new things that eventually I'll be able to share with you guys and with my patients. So it's very exciting. We're going to have some fun this weekend. Today is our final day. Come and join me.
My name's Sam Cooper. I'm with InMode. InMode is a medical device company that specializes in aesthetic devices, which are devices that are used for cosmetic treatments for patients.
I'm really excited because I just got my new toy last week, the Ignite RF. Just this year it came out. That's how new this technology is. And it's got all the bells and whistles. I'm going to be lecturing about it today. It has over a half dozen different technologies all on one machine, and it gives the doctor the ability to combine these technologies. You can either do one treatment or combine the treatment synergistically for the patient. And it's great for the patient because you can decide in real time, is that enough or do I want to add something else? And I'm really excited to get to using it for my patients now moving forward.
So Quantum and Body Tight are underneath the skin. So the main goal of those two technologies is to contract the connective tissue. So it basically pulls the skin closer to the muscle or shrink wraps the skin
three ways
down towards the muscle.
I would actually say, I would say that in my lecture.
Exactly.
It's three vectors. It's X, Y, and Z. Three-way contracture for the patient in terms of skin tightening.
Exactly,
right.
Three-dimensional.
Right.
And then the Morpheus is RF with microneedling, and then that treats the skin itself. So if there's any loose, crepey, or thin skin, Morpheus, the way that it works is that it applies heat to the deep part of the skin and the superficial.
And there's also collagen building, right?
Exactly. So it builds more collagen in the skin to thicken the skin and make the skin smoother and tighter. So they work well together where you can get the shrink wrapping of the skin.
I'm going to have to use some of this on myself, Sam. You know, I keep hearing about red light therapy, blue light therapy, infrared light therapy. Let's find out a little bit more about this technology. I'm curious. Let's see what it's all about. Andrew, hi. I'm Dr. Setari. Tell us a little bit about this curious technology. I want to hear more about it. Tell us what it's all about.
Right here we have our LED light therapy devices. They are a polychromatic device with red, blue, and near-infrared lights. As you can see, all our devices are flexible, shape-taking. You can place them anywhere on the body. And we just wanted to create a treatment for all kinds of uses that's non-invasive. Anyone can use it, from professionals to retail customers.
What can you use this for? Like, what's the therapy? What treatment? What will it help us treat?
So we are FDA cleared for 5 treatment modes for acne, fine lines and wrinkles, aches and pains, body contouring, and hair restoration.
What's the mechanism of action by which this will help hair to grow?
So essentially what the red light does for hair restoration is it extends the growth cycle, or the growth period of the follicle cycle.
It extends the cycle.
It extends it, and then it delays the death cycle. So you're going to be growing hair for longer, and then it's also going to delay the part where your hair is dying out.
What's the mechanism of action by which it'll help with pain relief?
So it upregulates the ATP process in the cell.
Excellent.
So you're producing more energy.
That's what I wanted to know.
Able to, reduce the inflammation, increases microcirculation, so you're able to, reduce the pain, heal a little bit faster.
I see. Excellent. Okay, very good. Now, is this something that you can only get with a prescription then, through your doctor, or can patients go ahead and purchase this on their own over the counter?
We're completely FDA over-the-counter cleared,
Oh,
so
okay.
anyone can purchase.
Andrew, thank you so much for your time. I appreciate it. An important part after liposuction is massage, and I teach my patients how to do their own lymphatic massage, and I tell them that they can either do it themselves at home or they can go to a professional. And now we're going to talk to some professionals on how to do a proper lymphatic massage and why it's so important, either after liposuction or just in general. Hello, ladies.
Hello.
I understand you are the professionals on proper lymphatic massage. And there's a name for it. Tell me about it.
It's called manual lymphatic drainage.
Manual lymphatic drainage.
Yes.
Great. Tell me about that, please.
So it's a very gentle, soothing, nurturing type of clinical massage. We specialize in the water technique, and it's just very relaxing. It's great for patients after surgery. It's very soothing, and it helps to reduce inflammation, swelling.
Yes, and we have to make sure that we're traveling towards specific lymph nodes to help get rid of that excess swelling and fluid that can kind of cause, scar tissue and fibrosis if it builds up. Basically, opening those little lymph capillaries and guiding it towards certain lymph nodes. So we're not pushing, we're not
Getting
using
deep in there,
hard
deep
tools.
pressure.
Very light
It's
pressure.
gentle. It's gentle.
Gentle, very gentle.
Got it. If you go too hard, you actually close off those channels.
Correct. You're actually inhibiting lymph flow, so we don't want to do
Like
that.
think of a straw, how delicate a straw is. If you press it, then nothing can get through.
You compress
Right.
it. Got it. Do you guys go to the patient's house and offer your services, or do they come to your office where you offer your services, or both?
We do both. Yeah, we do both.
We have an office in Tustin, Orange
Excellent.
County, but we do offer services in-home if that's a little bit easier for them, especially post-op when, say they've had a tummy tuck and a BBL and it's really hard for them to move
Get around.
Here's a key question. How soon after surgery should they start massaging?
We like to see them about day 3, as that's when swelling peaks. But anytime within that first week after surgery is great because the sooner we can get them in, the sooner we can start facilitating that movement.
Okay, well, thank you. That's
you
a great
so much.
service
Thank
you
you so much.
provide. It's
Thank
wonderful.
you.
Thank you. Another very important part of the treatment after liposuction, after breast augmentation, after any kind of cosmetic surgery for the body is the garment. Now we're going to talk to some expert professionals about their garments and why it's so important. Follow me. Hello, Roman. Dr.Setari, how are you doing?
Thank you, I'm good, thank you.
So tell us about the wonderful garments of Medical Z and
Medical Z,
what sets you apart and why they're so important.
well, we need garments after any plastic surgery procedure, mainly liposuctions. That's something that you need to wear right after surgery in the OR, usually the nurses and the doctor. Once the surgery is done, they put the garment, the patient wakes up, he's already wearing the garment. That helps to contain the swelling and reduce, to speed up the recovery.
And I can see from the various permutations, they're specifically designed to compress only the areas that have been treated and very comfortable for other areas.
Correct. So we came up with the 17 to 21 millimeter of mercury based on a clinical study that we did. Clinical study was done with Dr. Iluz, who was one of the pioneers of the liposuction techniques back in the 80s.
Right.
So we did a clinical study with him, and we probably tested with about around 200 patients. We measured them before, measured them after surgery, and we tried different type of compression to see what would give the best results, like visual results and containing of the swelling.
I love it, very scientifically based.
It is.
Excellent.
It is.
Roman, keep up the good work, my friend. I really enjoy it. Thank you so much. Thank you. Traditional liposuction is a dinosaur. This is the days of smartphones and smartwatches. Increased safety, faster, more comfortable recovery, and more organic, natural looking results. That's what your patients demand, that's what your patients deserve, and that's what you as specialists should be offering them. They need to keep up to date in a very rapidly changing technological environment. Thank you.